Danielle, for that warm welcome. I don't know who wrote that. I also want to take this time to apologize to Chris Ham for not answering his email when he wanted to send out the bio and email to everybody. He made me look like the best dentist in the world, and only half that is about fake news. I think he went on my websites and took some stuff from there. That was really kind of you. Thank you, Chris, for doing that. All right, so like Danielle said, my name is Carl Embury. I'm with Lancaster Dental Associates. I've been a dentist for going on 6 years now, but I just started there about a year ago. It's my third job as a practicing dentist. So, a little bit about me. I was born in the little northwest corner of Alabama, believe it or not. You don't hear a southern accent because I left there 8 months into my life and ended up in Perry by the age of 3. My dad had a job that bounced us around the country for a little while. He finally quit that because after 3 or 4 moves in 2.5 years, he said it's enough. Him and my mom brought us to Perry, where I was raised. And I have one sister. She's 19 months younger. We're almost Irish twins. And her name is Janice. And that's us right here. I'm going to use this laser pointer because it's cool. There is my mom, my dad, my sister, her boyfriend of 8 years, and my daughter, Evelyn. There's my wonderful, beautiful wife, Caitlin. There's when I was athletic at one point in my life. Played college basketball at Alfred. I was a 3-sport athlete in high school. Sports were kind of my drug, specifically basketball. I shot 500 shots a day. I was addicted to it. I was fortunate enough to play at Alfred, recruited by them. I did finish 5th in my class academically, but don't get too excited because there's only 6 of us in the class. Joking there too. All right, I set my sights on dentistry as a senior in high school, and I kind of went for it, full bore ahead. I put academics before sports, and finished with a 3.7 GPA in undergrad. Got into dental school, very fortunate to get into dental school. We had 2,900 applicants for 90 spots, so don't let those doctors fool you. The percentages were much lower to get into dental school than medical school that year, so I take pride in that. Keep going here. September's a pretty important month for me and my family here. I actually started dating my wife in dental school. She's also a dentist. We started dating in September of 2011. We got married 4 years later in September of 2015. We then bought a house, and then the house came with an electric fence, so naturally you want to get a dog when you have an electric fence already at your house. So we got a dog. We didn't want one in the sheds, so we got a goldoodle. There's Betty right there, and that was when she was 9 weeks old. There's my daughter with Betty on her bed. That was about, I think she was like 5 months old at the time, 5 or 6 months, and Betty was going on 2 years. We did have a daughter in September of 7. So you see September's been a theme all the way through my life here, although I was not born in September. All right, enough about me. Why did I choose to go into dentistry, or why is dentistry important? I kind of wonder why I chose it. I like the relationships I develop with my patients. I like to develop that long-term trust. But why is dentistry important? Why do you need a dentist? Basically, it's been proven that people who don't take care of their mouths typically aren't the healthiest individuals. The mouth's been said it's the window to the whole body. Okay, many diseases actually have oral presentations. Specifically, one really important fun fact is that people undiagnosed with HIV and AIDS will actually develop this really thick red line by their gums called linear erythema. That's kind of one of the signs that you do have HIV. Certain cancers show up in the mouth. Everyone knows about Jim Kelly. He's had a pretty substantial bout with oral cancer. He actually is missing his entire top jaw now. Really sad, but he's a fighter, and he's an inspiration of us all, obviously. Everyone knows about cold sores, herpes. Believe it or not, it's really common to have herpes simplex 1. That's the cold sore. More than half the population has that. Fungal infections. Diabetes is important to talk about because people with diabetes tend to have a higher incidence of periodontal disease, where the bone kind of goes away from the tooth. They also take longer to heal from major surgeries and extractions and stuff like that. It's important to note that doctors also only get a 2-hour lecture throughout their 4 years of medical school on the oral cavity. So we're at the front lines of all the diseases and everything like that, and maintaining your oral health. Also, it's important to note that you need teeth for chewing, obviously smiling, speaking. It's been proven in research that besides the eyes, the teeth are the next thing people look at to determine if you're attractive or not. All right, so why choose Lancaster Dental? There's tons of dentists in Buffalo. It's a very saturated market. We have a dental school right here in town where I teach on Thursdays. And what sets us apart from everyone else? First of all, we have the same staff there. They've been there for 20 to 25 years at least, a lot of them. You'll come in, you'll see the same faces every single time. And you'll actually see their faces later on in the slideshow. We keep up with the latest techniques and technology. You hear me talk about our 3D scanner, our same-day crowns. Some people in here have actually seen the scanner firsthand. It's been used on them. It's really cool. It kind of helps with diagnosis and shooting you straight with what you need, and showing you exactly where you are in your oral health. We have the most thorough and quality-based training. We like to treatment plan based on your needs. We'll go into that more later. We just want to get you in a stable spot. All right. Frank emailed me and wanted to know this, and Jed's here in Frank's place today, so we'll have to watch them on Facebook. But how do you know you're not being shortchanged? All right, so you go to your doctor, you go to a dentist, you put yourself in their hands, and you hope that they're not, for better lack of from screwing you. You know what I mean? You don't want to be taken advantage of. So how do we convey that we're not doing that to you? We go through all the necessary steps to treatment plan and adhere to your wants and needs. Okay, I always ask the patient first, what do you want done? What are your expectations? What are your goals? And then we go through, is that realistic for them, or is that something we can handle? When a patient comes in with cavities on every single tooth and all they want is their teeth whitened, that's really not the best way to do that, and fillings up front will not whiten. So we're honest with the condition of your mouth without being demeaning. We will educate you on preventive measures excuse me, to avoid those major dental catastrophes and events like that. We also like to give you multiple options to achieve your desired result. There's never one option to get something done besides maybe a filling. Even then, there's materials you can choose from. Going back to that, we also don't have any surprises coming at you. We let you know the fees ahead of time and develop treatment plans in order for you. Here is our office. Okay, the doctor's up front there. I'm the lowly full-time associate on the left. The partners are Dr. Kevin and Dr. Rich there in the middle. Dr. Hrab's been there about 13 years. He's just there on Thursdays when I'm at the dental school. There's our wonderful dental assistants and hygienists. And then there's the faces you see the most, the ones up front. Talk to on the phone all the time here. Big shout out to Dana, who actually did our headshots for us before she even joined this chapter. So, as you can tell, she did a wonderful job, and we're very happy. All these pictures are on our website. All right, what man here? 2 minutes. Perfect. All right, so good referrals for me. I take pride in being able to talk to patients who are deathly afraid of dentists and getting shots off that ledge so we can get stuff done without even using any sedation techniques or anything like that. It's just more developing that relationship and getting that trust so I can actually do it on them. People who are unhappy with their current location are looking for a change of pace. I'm not here to steal patients, okay? That's very unethical, number one. And if you're happy with your current place, that's wonderful. Don't feel obligated to come be my patient. I would advise you to maybe come to the office to see what we're all about, so then you can actually refer people to me based on you've been there, you've seen what our facility is all about. People who haven't been a dentist in a long time, worry about their mouths, like I said before, we will get you to a stable spot and hopefully maintain that for the rest of your life. And busy people, I know we hear everyone here says the busy working mom, the busy family, the large families. That's true at our office too. We have 5 hygienists that work at a time. We can see 3 kids and the 2 adults if you want to bring the whole family, little family bonding time at the dentist. Where you guys actually don't talk to each other, other people's hands are in your mouth. We have convenient hours. We're open 7 a.m. to 7 p.m. Monday, Tuesday, Wednesday. We have Saturday hours 8 to 1, and someone's always on call for the office. Even new patients who have disasters, like say the wedding day comes up, they fall and break a tooth the night before because they're having too much fun. Most of the group will do that. And then we have 24 hours. I actually had a lady come in. She actually fell getting into an Uber the day after Thanksgiving, so I had to go in on Sunday morning and see her. But that's our gist. That's what we're all about here at Lancaster Dental, and I'm looking forward to hopefully meeting a lot of you and having you at my office. Do you have any questions? No?
That's good. Yeah.